Wow, these are the heroes. These parents deserve the award. I feel tremendously honored to be here tonight among these wonderful people and to receive this award. There's so many others that they could have chosen. When Vinnie Pompey called me to let me know about this award, we had been through a very rough week at work. And this award was so important for me because it reminded me that all the effort is worth it. And because of that, I would like to share it with my team in Dallas because this is a teamwork, and they deserve the same recognition. Also because they put up with me. I would also like to thank my husband and my son who are here tonight, and they almost didn't make it to the flight and arrived without their luggage. Thank you. So I would like to share a little personal story that I haven't shared with many people. When I was a child, I had a secret, and it's not that I was LGBTQI. It was actually that I was not Catholic, and that's because I grew up in Spain, and in the 1980s, not being Catholic was seen as a thing of the devil. And I had to go to a Catholic schools because that's what my parents wanted for me, because those were the best schools. And they told me, don't say you're not Catholic because they're gonna kick you out of the school. So from elementary until I was 13, I could not say I was Catholic. And when all my friends would line up to confess to the priest or to do their communion, I had to hide or make up an excuse or just fake the confession, which was probably horrible. But I felt what it was to keep a secret and to feel different. But you see, that's all relative, because I live in Texas now, and certainly not being Catholic, actually my family was Christian, so I was a Christian. So being a Christian in Texas now would be normal. So being different is all relative. What I went through is nothing compared with what my patients, my transgender kids, go through every day, just to be true to themselves. And they've taught me how important it is to be true to themselves, which I wasn't when I was a child. And they're so brave and so mature. And they have to sometimes keep a secret, just like I did, but just to be safe, just to keep their bodies safe. Do you know what we, the health providers and social workers and other mental health providers that work with these kids, fall in love with? Because we do. We really love our kids. That they're so brave and so mature that they take the risk of being humiliated against, losing their friends, lose hopes for a date, never have any romantic relationship, be kicked out of their houses, just to be true to themselves. And you know what we fall in love with too? The parents. These parents are so brave that they change their own beliefs. They bring their family around, their communities, their churches, the physicians, because they love their kids and they support and understand them. It's hard to understand why there are people that instead of honoring these kids and families and protecting them, want to pass laws that deny basic rights, like using the bathroom. From my view as a pediatrician who has seen many transgender patients, and I wonder how many transgender people, those people who want to pass these laws actually truly know, but from what I know, that goes against my effort, my mission to improve the quality of life of those kids, which is what I swore to do as a physician, not only for transgender kids, but for all kids. I didn't receive any medical training to provide care to transgender kids, because at that time it wasn't available. I simply listened to the kids, to Evan, my first patient, and his mother. That's all it took me. It only takes a little bit of empathy. And today, I'm very excited to see that there's more research and there are established guidelines of care. So there are guidelines. So to those health providers who, for whatever the reason, refuse to see or to care for transgender people or individuals who have a different sexual identity or expression, they're missing out because if they care for these patients, they'll earn the best, most compliant, because they'll never miss an appointment, they'll always take their meds, and Heather, my social worker, is sitting right there. When a patient doesn't show up, we get really worried because they never miss an appointment. And they're the most grateful patients and families. So as a physician, that fulfills your mission. That fulfills why you started this profession. And to be clear, when transgender patients are being discriminated against or refuse to be seen because of their gender identity or expression, they are being harmed. And they will avoid seeking medical care. And that goes against our first principle. Our first principle for a physician is do not harm. Do no harm. If you're avoiding to see a patient, you're causing harm. And that applies to every patient. So as health providers, we can't harm people simply because we don't understand. We have to make an effort to understand. I didn't know much about being transgender before I saw my patient, my first patient, Evan. We're duty-bound to understand. To my patients and their parents and caregivers, you are the real heroes. Thank you.